Doctors at the McGill University Health Centre have announced a first here in Canada. A woman whose eggs were frozen has given birth to a healthy baby boy. Caroline Van Vlordingen is at the Royal Victoria Hospital where the announcement was made. Caroline?
Well, Brian, just last week, doctors in Toronto announced what they said was a Canadian first. A woman whose eggs were frozen and then thawed had become pregnant. Well, now we hear that in Montreal, a baby was actually born with the same procedure just last month. It was a baby born on April the 29th to a 26-year-old woman who had had problems with fertility for the past 2 years. She became part of a clinical study. They froze her eggs, thawed them, reimplanted the frozen egg, and it was fertilized, and she was able to conceive and give birth to a healthy baby boy, as I said, just a couple of weeks ago. With me is one of the doctors who made this Canadian first possible, Dr. Seang Lin Tan, who is the director of the Reproductive Center here at the MUHC. Congratulations, first of all.
Thank you, Caroline.
Dr. Tan, we've heard a lot about this being done worldwide. What is new about the way that you're doing it now? Because there have been live births in Italy and other countries. What's new here?
The difference is that most centers have used what is called the slow freezing technique, in which the temperature of the eggs is slowly cooled down. The problem is that eggs are very fragile, and when you do a slow freezing technique, very often ice crystals form and then they damage the eggs when the eggs are thawed out. So that the survival rates of those eggs are anywhere between 50 to 65%. Whereas we have developed a new method of a rapid egg freezing called vitrification, together with a special device called the McGill cryo leaf. And using this system, we have successfully frozen and thawed and obtained survival rates 95% of the eggs survive.
So you've almost doubled the survival rate of these thawed eggs. Now, how many women have you actually been able to successfully do this with here in Montreal?
We have frozen eggs for 16 women with varying forms of cancer, but we are waiting for them to be cancer-free for a few years before implanting back the fertilized eggs. But we have treated also 15 women who were having fertility problems, which took part in this clinical trial. We vitrified the eggs for them, we thawed it out subsequently, and then we transferred the embryos. And of these 15 patients, 7 of them became pregnant.
So 7 are still pregnant, or that 7 includes the one who gave birth?
7 includes the one who gave birth. So altogether, we have about a 46% clinical pregnancy rate per patient that was treated, which is good because it is almost the same as the results of IVF using fresh eggs.
So this is geared towards women who want to postpone pregnancy, or women who are undergoing cancer treatment, or both?
Well, it can be used for both. I mean, obviously, for women who are undergoing cancer treatments, this offers them the prospect of preserving their fertility and setting their minds at ease and be able to undertake whatever chemotherapy they need for however long they need, because once you freeze the eggs, they can be there for 3 years, 5 years, 10 years, it doesn't matter. But it can also be used for women who just want to postpone childbearing.
Right. Well, I'm sure that raises a lot of other issues as well. Thank you, Dr. Tan, for explaining this to us, and congratulations again.